Hello and thank you for joining us today for our webinar about the Master's Programme MSc Advanced Practice at Glasgow Caledonian University. We're joined today by Michelle Rutherford and Catherine Wright. Sorry, my screen froze. Who will talk about the content of the programme and the learning experience here at Glasgow Caledonian University. Feel free to ask any questions in the chat box on screen. We'd be delighted to pick those up. And with that, I'll hand you straight over to our academics.
Thank you very much, Jenny. Welcome everyone to our session this afternoon on the Advanced Practice Programme here at GCU. My name is Michelle Rutherford, and I am one of the co-programme leads of the Advanced Practice Programme along with my colleague Dr. Catherine Wright. My background originally was in physiotherapy, although for a large number of years now I've worked across all allied health professions and actually work very closely with my nursing and medical colleagues as well. I've been here at GCU for just over 10 years now, and my own research focuses on psychologically informed practice and how we can educate our AHP students in this really important area of practice. I'm going to hand over briefly to Kate to allow Kate to introduce herself.
Hello everybody, thank you for coming along today. So my name's Kate, or Catherine Wright, and I've been at Glasgow Caledonian for about 20 years now in a variety of roles, but I'm a lecturer in the Department of Biological Biomedical Sciences and the co-programme lead for advanced practice. So I've had a varied career. I did my PhD in London, and previous to that did an MSc in London in human reproductive biology, and then I became a cell biologist and have been working in the area of diabetes for the last number of years. So my research is in diabetic wound healing and how to discover new therapeutic targets to improve diabetic wound healing.
Thanks very much, Kate. I should actually have said I've also undertaken my MSc here at GCU too. So similar to you all, if you're thinking about starting your journey here, I've undertook my own MSc at GCU and followed a similar pathway to the Advanced Practice Programme. So I hope you can see that Kate and I have a lot of experience, and we know what it's like to be studying and working and making the decision that you're making now to come and join us here at GCU. Thinking more then about the programme, the Advanced Practice Programme is designed to develop not just your knowledge and understanding, but to develop critical thinking skills, to develop your knowledge of research and of leadership to equip you for the modern healthcare challenges that you will experience. At GCU, we're very proud of our emphasis on common good values, particularly of integrity, creativity, responsibility and confidence. And we very much value the common good ethos we have here at GCU. I won't spend too long talking about the philosophy, but I think it's important that you understand what the programme has been built upon. And really, we acknowledge that health and social care practitioners can work within the public sector, within private and in voluntary sectors, and you're increasingly required to work in challenging environments. And we all are aware of the near constant change and of the complexity of the patients that we work with. The overall aim of our programme is to provide you with educational experiences which promote reflective, analytical and critical thinking, but particularly to enable you to meet the political, workplace and practice demands that you will face as you work through your career. We try very hard to ensure our programme is flexible, that allows you to bring in maybe previous learning. You can learn from clinical settings, but we also support you in development of other areas such as research and leadership, as I have mentioned. And the overall focus of the programme is the 4 pillars of practice, which are clinical practice, facilitating learning, leadership, and evidence research and development. So we have a wide range of modules that allow you to develop your knowledge, skills, and behaviours across all 4 pillars of practice. In addition to our general MSc Advanced Practice pathway, we also have specific pathways in areas such as musculoskeletal health, diabetes care, podiatry, paramedicine, travel medicine, and expedition and wilderness medicine. So a wide range of pathways in addition to our general MSc Advanced Practice pathway. I'm going to explain in the coming slides what is required for each pathway and to outline a number of our optional modules. If you're studying with us full time, the plan would be that you would undertake your programme over a 1-year period. You would join us in September and you usually finish the following October. So it's just slightly over the 1-year mark. Those who are joining us part-time, the programme is usually undertaken between 3 and 5 years. The average is 3. We do have some time built in there that you can take some periods of time out higher. The maximum period would be 5 years. And we do have a range of distance learning options, which means you can study online and we have exit points across the programme as well. The first point is the postgraduate certificate in advanced practice, which is 60 credits. The next step is postgraduate diploma, which is 120 credits, which must contain advanced research methods. And for the full MSc, 180 credits, it must include advanced research methods. Those are specifically for the general advanced practice. So you more about the 4 modules for the other pathways. It's just to let you know that you can exit at agency or community level. So we'll start firstly with the general advanced practice pathway. The only mandatory requirements on this pathway are advanced research methods and dissertation, which allows you 90 credits of optional modules. So there's real flexibility within this pathway. I'm going to cover some of the optional modules in future slides. For those who are keen to specialise in musculoskeletal health, you will see that advanced research methods and dissertation are still here. But there's an additional core module called Human Movement and Musculoskeletal Analysis, but you also still have the option to select 60 credits from our optional module list. I should also say that advanced research methods and dissertation assessments should focus on a musculoskeletal topic in order to be awarded the musculoskeletal health pathway. I'm going to pass over to Kate now to talk about diabetes care.
Thanks, Michelle. So diabetes care is the pathway that I'm responsible for. And as you can see, this is a little bit more tailored, prescriptive, although it does have an optional element to it. But we have put this pathway together to encompass many of the topics and skills that you would need to become an advanced specialist in diabetes care. So we start off again with advanced research methods, which would focus on a diabetes-related topic, and of course dissertation, where a diabetes-related topic would be further investigated. And then we have various modules, including looking at pathophysiology and chronic complications, looking at podiatry aspects, nutritional lifestyle aspects, team working, and so on, with this optional module that you can pick from any of the modules that we have in the advanced practice suite. We have a new program as well, new pathway within our program that is just starting this year, which is advanced practice podiatry. And as well as doing advanced research methods, dissertation, and this is a bit more prescribed, so you would do human movement and musculoskeletal analysis, as Michelle's already described. And then there's another module called clinical investigations with one optional module of 30 credits. And all this builds to a distinct pathway within podiatry. Paramedicine is another pathway that has joined us for this coming year. We had a previous MSc in paramedicine. They've come along to join us as part of our suite this year. So there are a range of optional modules that can be taken for paramedicine. including looking at the acutely unwell adult and so on. And this builds into another sort of tailored type of pathway for advanced practice. I'll pass you back to Michelle now.
Okay, thank you, Kate. The final two pathways are bespoke pathways that were designed specifically for students who are keen to join us following completion of a postgraduate diploma in expedition and wilderness medicine or in travel medicine at the Royal College of Physicians and Surgeons in Glasgow. So students will undertake, in this case, the expedition and wilderness medicine pathway, they will undertake the International Diploma in Expedition and Wilderness Medicine at the Royal College, as I've mentioned, and following successful completion, students can choose to join us at GCU and undertake a dissertation in a related topic and exit with the full MSc, Advanced Practice, Expedition and Wilderness Medicine. So this is specifically for students who have undertaken the PGD I mentioned at the Royal College. And similarly, travel medicine, this is for those who've undertaken the travel medicine diploma at the Royal College. You would join us, undertake dissertation in a travel medicine related area and exit with the full MSc. So we now have over 30 different optional modules on the Advanced Practice programme. I won't use up lots of time this afternoon talking through every single one of them, but we have a couple of slides here with some examples to give you an idea of what you may be able to study. And as I mentioned earlier, the modules span all 4 pillars of practice. So if you decide you would like to work on your research skills, you will be doing advanced research methods anyway. But you might want to take another, for example, work-based learning type module and focus on research. Or if you would like to increase your knowledge and understanding of leadership, we have our advanced leadership module. If you would like a more clinically focused advanced practice degree, we have a number of clinically focused modules, such as advancing practice and neurological rehabilitation, the lower limb and foot and diabetes, as Kate mentioned, things like pathophysiology. We have a pathophysiology module specifically looking at diabetes. We also have a more general applied pathophysiology module that looks at a number of body systems and diseases and conditions that our patients can experience. We have some public health modules, such as infection prevention and control in a global context. And I'll move on to the next screen. We have some really acute modules for those who are working in critical care environments or are working in roles that might have been previously advanced nurse practitioner type roles that I now know a number of AHPs and healthcare professionals can move into. So we have some modules such as the recognition and management of the acutely unwell adult that is delivered in conjunction with our colleagues in NHS Greater Glasgow and Clyde. Another module, advanced clinical assessment and decision making in acute and primary care as well. So a range of clinical modules. We also have the prescribing for healthcare practitioners module, which is a popular module across a range of healthcare professionals. But new for this year, we also have artificial intelligence or AI for health and social care practitioners. So a really topical area in health and social care and in education too. So we hope we can see that just from this sample here, which isn't all of our modules, that you can see that there's a whole range of modules that may be of interest to you and your current role or any future roles that you would choose to move into.
So what would you expect when you come to join us here at GCU? So we've got a huge number of different teaching methods, so as well as traditional lectures where you might be in with quite a large class. We have smaller tutorial groups, seminar groups. We really encourage you to speak to your peers as well as speaking to us, and we've got lots of ways in which we can sort of encourage group work and exchange in that way. We've got really good access to lots of different lab simulations, clinical simulations. We have great computer support materials as well. We've got our GCU Learn platform, which is a Blackboard-based platform, which contains all of your learning materials and where you can upload materials, and you can upload assignments to as well. And we've got lots and lots of ways to encourage independent learning. We have a fantastic library, and we've got the Learning Development Centre tutors as well. So there's a huge variety of ways in which you can learn and in which you'll be supported to learn. So thinking about support and resources then, as well as the support that you get from me and Michelle as your programme team, you will also be looked after by your module leaders who are experts in the subjects that they are teaching. And you may well have class tutors there as well that specifically look after particular areas of modules. You'll be allocated a personal tutor, who is the person who is able to support you in terms of if you had some issues around accommodation, for example, or some personal issues that might affect your study, then they'd be the person to help you with those sorts of things. I mentioned the Learning Development Centre before. The tutors there are fantastic. They run all sorts of workshops on things like different ways in which to write essays, for example, if you've not done things like that for a while, referencing, computer packages. They're excellent at allowing you to plan for things like exams, revision, all sorts of things they can help with. We have the library, which is a brilliant resource. It's over several floors. There's lots of different spaces where you can work, quiet areas where you can work in small groups with your peers as well. And the library team there are brilliant at enabling you to get familiar with the ways in which you need to access materials for research, for your dissertation, for example. We also have the student wellbeing team who would look after you in any cases of extra support that you would maybe potentially need. And the Students' Association is there for all of the students at GCU and has a huge range of clubs and societies, and also advocates for you as well. Okay, so just really to say, we would be delighted to have you here at GCU. Please do come and join us. If you've got any questions, you can ask us today. The other way to get in touch with us is to email our joint mailbox, which is there. It's mscape@gcu.ac.uk. That's a joint mailbox that both Michelle and I can access, so we can answer your questions as best we can that way. Michelle, did you want to finish off with anything?
No, just to welcome any questions and just to echo Kate's thoughts. We'd be delighted to have you join us here at GCU, and happy to answer any questions via our mailbox. If you're listening to this recording and you'd like to get in touch, and we can arrange a Teams chat with you, or we can answer your queries via email.
Thank you very much, Michelle and Kate. That was really thorough and informative. I hope that's answered everybody's questions who are live on the session. But as our presenters say, if anyone in the audience wants to ask any questions, please do take advantage of this time and pop any questions that you have for us in the chat. Anything about the programme or anything about the applications process, we can also cover off here. So I'll give you a moment or two to type up your thoughts. Thank you. Okay, it looks like we don't have any questions from the audience. So I'd just like to thank our presenters for a really thorough and interesting session, and to our audience for their time in attending this session. If anyone does have any questions after, do feel free to email those in to us, and we'd be really happy to pick those up. And just before you leave, this is the end of a week-long series of events. Do revisit the webpage where recordings of all our sessions will be uploaded, and you'll be able to browse those and get some more information about your postgraduate journey. I think we can close off the webinar just now. Thank you, everybody.
Thanks, Jenny.